about your diabetes? Do you think it's improving, and what's happening to that?
My diabetes, the day before the surgery, my blood sugar was about almost 350, 350.
Okay.
My diabetes blood sugar improved immediately after surgery.
Immediately after surgery. What
surgery.
were you taking for your diabetes earlier? Some
Met,
injections?
metformin.
Metformin, tablets?
Yes, tablets.
How many tablets in a day?
I was taking 2 tablets a day.
Okay.
Right.
And still with that, it used to be like in 300s?
300, sometimes even low 400s. My
okay.
blood sugar was bouncing
Did
around
your
quite a
doctors
bit.
prescribe you insulin or something like that?
Yes, I was on insulin for a period of time, yes.
Okay, you were on insulin. How much
Right.
insulin you were taking?
I can't remember, but I was injecting after every meal.
Okay.
Yeah, so 3 times a day.
And when did you get this diabetes? How old is your diabetes?
My diabetes was 6 years.
6 years.
6 years.
Okay. Not too old.
Not too old, yeah.
And are you pretty sure it was type 2 or type 1?
Type 2. Type 2 diabetes.
Okay.
Yes.
Good. So, can you check what was his HbA1c?
14.
Do you remember your HbA1c level?
14.
14.
Yep.
And you are from US,
Yes.
the best country in the world.
Right.
And
Where obesity is an epidemic.
Obesity is epidemic.
Yes.
And even diabetes is a kind of epidemic.
Exactly.
And you get a free treatment.
Right.
But still, your HbA1c was 14,
Right.
not controlled.
Right.
It should be 6.
Absolutely.
And, yeah. And at this young age, if you continue to have 14 HbA1c for a couple of years, it's definitely going to affect your eyes, heart, and kidneys and whatnot, everything.
Yeah.
So primarily, as I discussed with you before surgery as well, do not consider that mini gastric bypass will cure your diabetes.
Absolutely.
That's number one thing.
Absolutely.
But it will give you a very strong control over diabetes.
I noticed that after surgery, like today, for example, my blood sugar, the lowest was 90 to this morning. Fasting
90?
blood sugar was 100.
Okay.
Right.
That's good. Fasting was 100.
Right.
And now you're not taking any tablets.
No tablets
No
or
insulin.
anything. No
No.
anything.
So it looks like magic actually. The patient starts believing that I am probably cured of diabetes.
Right.
But with my experience of more than 10 years into this field, what I see is it looks like that you're totally cured, but you should never get that thing go out of your head.
Right.
Because it can come back.
Right.
It's standing at your
the door.
Again knocking at the door, ready to come back.
Right. Right.
How it can come back if you gain 10 kilos of weight over a period of 5-7 years, then again you'll be seeing fasting 140, 160, sometimes after meals 250.
Right.
That is the time again when you might have to start your tablet. So earlier there was some conflict between the surgical doctors doing the gastric bypass and the medical doctors treating diabetes. They would not believe this. They said, no. Bariatric surgery has got nothing to do with diabetes. But as we see, every day we see, as you have said, immediately after surgery, the diabetes improved. The reason is the bypass. Because now your food is going down, 6 feet down the intestine, and it is touching a new point. That new point is a new sensor. It's sending better signals to the pancreas, which in return is producing better amount of insulin. So this new point is giving a kick to the pancreas. With everything you are eating, it's giving a kick. Pancreas is producing more insulin instantly within the first hour of eating. That is what controls. And as we noticed on that day, after eating, rather your sugar was going down.
Right.
So that means the pancreas is being ordered to produce insulin right away.
Which is
And
good.
that is how it controls. But it is actually like you are a potential diabetic at present,
Right.
but controlled one. Like you see sometimes females have diabetes
Right.
during their pregnancy period. The sugar
Absolutely.
goes up, they are on insulin, and once the delivery happens, after that they are free.
Right.
They have no diabetes. So they are called as potential diabetics. So your condition is like that now,
Okay.
potential diabetic. If you have some infection, chest infection, sore throat, viral fever, maybe say 5 months down the line or 2 years down the line, you have any kind of problem to your body, some fever, some infection, during those days you must check your sugar levels. And you will notice that during the days of stress, that is kind of medical stress, if you have
Right.
fever, or if you're in some mental stress,
Okay.
during those days your diabetes will be slightly on higher side.
Okay.
And you might have to take half tablet. So
Okay.
that's what I tell my patients. Our target is not to stop the tablets.
Right.
Our target is to bring down the HbA1c from 14 to 6.
Okay.
Doesn't matter, you have to take half tablet for that, because earlier also you were taking 2 tablets.
Right.
So now you're not taking any tablet, but the sugar is well under control. So let us hope that you might not need any tablet, as 95% of my patients, they don't need the tablets even. So let's hope that you come in the 95%. But still, if you fall in the 5% who have to take 1 tablet or half tablet,
That's a lot better than.
yeah, our target is to bring down your HbA1c from 14 to 6. And that's what's going to fix all of your problems, everything.
Which is
The
great.
nerves will get back,
Right.
That's what we hope and pray for. Any other thing, any questions you have in your mind?
No questions, but I feel good that the neuropathy also got better right after surgery as well.
Good.
I can feel it in my hands and feet.
Yeah, the
Nice.
numbness thing
Right.
is getting better.
Right. I don't feel that shooting pain
Yeah.
as much. Yeah. Yeah. Sleeping really good as well.
Actually, your diabetes was kind of very bad diabetes, It was
Yes.
very high.
Yes.
It's not so common. Most of our patients who are coming, their HbA1c is like 10 or 11.
Yeah.
But your case, maybe you were diagnosed 6 years back.
Mhm.
Maybe you might be having some kind of subclinical diabetes which was not diagnosed.
Right.
Maybe for 1 or 2 years it was running like that.
That is a possibility.
Yeah, there is a
Yeah.
possibility.
Because when I was diagnosed, my blood sugar was 650.
See, yeah, that means I
Yeah.
think you must be having it from at least maybe 1 or 2 years.
Probably.
So it had already done a lot of damage to the nerves actually.
Mm-hmm. Yeah.
But still, just be careful. Keep on checking the diabetes.
I will.
This procedure will make you much better, but still keep every doubt
Okay.
about the diabetes.
Right.
I have
Really-
seen very old patients who have 25 years old diabetes.
Mhm.
They take time. Sometimes they have to continue with insulin for 2 months, and gradually their weight comes down and it improves.
Okay.
But generally 95% the result is like magical, like what we see in your case. But
Right.
still have an eye of doubt. Always keep checking.
I will.
right? And just let me know how it works.
I will.